Hi, I'm Dennis Wilson. At Delta Dental of New Jersey, we're committed to educating the public about the importance of good oral health and its role in our overall health and well-being. That's why we're proud to support the important healthcare programming produced by the Caucus Educational Corporation and their partners in public television.
Quality oral care, next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by Delta Dental of New Jersey. Everyone deserves a healthy smile. Partners for Health Foundation, partnering to make our communities healthier, better places to live. ADP, a comprehensive provider of human resources technology and services. The Fidelco Group, Suez, ready for the resource revolution. Johnson & Johnson. And by Cohn Resnick, Accounting, Tax, and Advisory, where forward thinking creates results.
Hi, I'm Steve Adubato. What are the keys to quality oral care? Here in the studio to talk about this very important but often ignored question, we have four experts. First, we have our good friend, Dr. Nicole McGrath. I should say everyone is a good friend here in the studio. She's the founder and chief executive officer of KinderSmile Foundation. Dr. Sam Joaquim, chief dental officer of Zufall Health. Dr. Mario Ramos is assistant director of the Children's Dental Center at the Boys and Girls Clubs of Newark, New Jersey. And Dr. Mary Voitis, director of the dental residency at Hackensack University Medical Center, Mountainside, my neighborhood hospital. I want to thank all of you for joining us. You know, this whole question of oral health, and there'll be information put up throughout this program. Is it, doctor, the question of quality oral care, or is it access to quality oral care, and is there a difference?
I think it's access to quality oral health care. When you're dealing with the targeted population, low-income, underserved communities, there's a huge problem with access to quality oral health care here nationally and more specifically in the state of New Jersey.
Mostly children?
I would say mostly children, but we do have adults too that there's a huge problem with access as well.
Let's talk about the fact that children, let's stay on children first. We'll talk about seniors in a second. But children, who are these children, and what are the barriers and obstacles they're facing?
That's a great question.
And you know Newark particularly well.
Yeah, as a pediatric dentist, we deal with this every day. You know, these children are your normal children in inner cities, particularly areas like Patterson, Newark, Camden, where accessing oral health care is a very difficult challenge. These children's parents have many obstacles to overcome on a daily basis, so dental care becomes less of a priority. When it's time to locate care, that becomes a hurdle as well. Cost of care, providers who are willing to see these children, and the needs that they have may be beyond the local dentist's needs. So it's difficult for these parents to navigate the system of access. So these are the kids in the inner city. These are the kids you see every day on the street. These are the kids that are missing about 51 million hours of school hours a year nationally because of dental problems.
What kind of issues are children facing who don't get the dental care, the oral health care they need? Let's talk about that.
I saw a child yesterday, 8 years old, came in with a swollen face, had never been to the dentist.
Swollen face?
Face from a tooth abscess. Had never been to the dentist. Has insurance. We're there. We see emergencies every day. The mom did not bring him until he was sent home from school with a swollen face and couldn't function.
Absolutely.
Is this in the community I was talking about, in the community
absolutely.
I know well?
Absolutely. This is the area surrounding Mountainside, the Montclair, you know, West Orange, Newark. We see patients from a wide variety. It's not uncommon.
What happens? First of all, how does that happen?
Education. I think education of parents in terms of the need for dental care, prevention, making sure that the children get fluoride vitamins. This child is 8, has never had a fluoride vitamin. That should have been started at a few months of age.
Why do you think that didn't happen? You're saying purely because a parent doesn't know that is important, that's why that doesn't happen?
That's a part of it. And then I think what I see is that diet feeds in. When I see young children who come in with mouths full of caries, what do they have? They have juice in their bottles. They drink soda, they eat candy, and it just goes on, and it's not the mom's fault, it's the dad's fault, it's the grandparents' fault. They give it when he goes to an office, somebody.
Mm-hmm. And there are long-term ramifications. People think, oh, it's a problem with your teeth. But let's talk some of the longer-term, complicated, significant medical and health ramifications dealing with oral health.
Right, so the bacteria from the mouth can travel throughout your body. It could contribute to heart disease and other medical conditions as well. So what we try to do, I think, I would agree that education is a big part of what we're trying to do, and focusing parents and patients on the risk factors. So just like you think of cholesterol and high blood pressure contributing to strokes and heart attacks, we want patients to think about the risk factors.
Such as?
So bacteria is a big one. So the amount of bacteria in your mouth, are you cleaning it on a regular basis, removing the bacteria?
How would one know?
How would
a parent and or a child know?
Well, I
If
think
they're quote unquote removing the bacteria.
that's basically brushing and flossing, disrupting the bacteria that's
How
in
often?
your mouth. That daily basis would be ideal, because after the bacteria has been there for a day, it's going to grow and get stronger. So the longer you leave it unchecked, the more harmful it becomes, and it could again travel throughout your body and cause issues in other areas of your body. So. And of course, the longer it stays there, it can do more damage the bone around the teeth. So bacteria is a big thing. The other major thing was mentioned as well is diet. So how often are you eating sugar? How often are you drinking sugar drinks? People don't realize how much we're consuming sugar through drinks, and that also relates to medical conditions, diabetes, and other health conditions.
Let's clarify. It's not just urban, poorer children with serious socioeconomic challenges. It's other children. It's other people. Talk about it.
Absolutely. I believe that it's lack of education. Just piggybacking on what Dr. Voitis said, about a month ago, a nurse from one of the Montclair schools called us, KinderSmile.
Describe your organization.
Oh, KinderSmile. It's a 501c3 nonprofit organization that increases oral care access and oral care education for low-income children. And we do that by partnering with schools and community organizations. Right. And so this school nurse called about a month ago, and she was in desperate need. She had a 10-year-old girl who came to her office every single day for about 2 weeks. This 10-year-old girl was in pain. She could not focus in school. This is in Montclair. So yes, I agree, it's in the inner cities and the underserved communities, but it's also all over. I mean, I raised my children in Montclair, and so at that time, I immediately referred her over to Dr. Voitis, and we partnered together to help the children with access to care. So long story short, she ended up at Rutgers Dental School for long-term care. But yes.
She needed help.
She needed help.
What would have happened if, I hate to ask it this way, but people need to understand, how old was she again?
She was 10 years old.
Doesn't get help over an extended, first of all, that's a long period of time already.
That's a long period.
But say it's months. What could potentially happen here?
Well, in 2007, Diamante Driver, a 12-year-old boy from Prince George's, Maryland, died from a tooth abscess, a brain infection due to a tooth abscess. So there you go, systemically.
The boy died?
Died, absolutely, 12
What's the
years
correlation?
Old. Infection, the bacteria spread. A lot of parents think that it's a localized infection, but the bacteria spreads throughout the bloodstream. So absolutely, it's deadly. It can be deadly.
The reimbursement, the way the government reimburses for Medicaid, and Medicaid is the government program, the federal program, that is in place to help those who do not have the means to pay for health care, together with the Affordable Care Act, put it all together. Reimbursement for the care we're talking about. You raise your eyebrows?
It's very low. So there are very few dentists who are practicing in the community who will accept Medicaid because they can't financially keep their offices open and see that population.
So what's the incentive to do what is necessary?
So I train residents. So I have 5 residents who are with me who are general dentists, and they come to learn about pediatric dentistry as well as teenagers, adults, and geriatrics. And hopefully they will bring some of those skills into the community. And we happen to be in some centers where we see the Medicaid population, and we welcome that population. We don't turn them away.
Talk about it.
It's a big issue to grab your hands around. Certainly reimbursement is an issue. Also, being able to, there are children who have Medicaid who don't access it. So it's a matter when you say that, we throw that word around education. What's important to note is that we have efforts like the Academy of Pediatric Dentistry where we do our dental home concept. And we want children in New Jersey and all through the nation to see the dentist on their first birthday. That's when we want to see children. And that's supported by, and I'll tell you why. We want them to form this connection, this dental home. Just like they have a medical home, they need a dental home. And so we have educated our dentists, our pediatric dentists, to be able to see a child at age 1, to make that connection, not just for the child, but for the parent to have somewhere to go when they have a problem, when they have a question, when they have a trauma. So we want that to start right away. And we want that connection to start at 1. And every time I say that, people still raise their eyebrows. We've been talking about this for more than 10 years. It's important, and that's everywhere. That's not just in inner cities and poor communities. This is everywhere. So once parents understand that dental care is part of overall health, children who have dental problems can't thrive, can't grow properly, can have digestive issues, certainly can have problems learning and focusing. So it is part of our overall health. Unfortunately, it's been separate too long.
Let's move. And by the way, Boys and Girls Club is doing a lot of work in this area. Real quick, describe it.
Yes, we have a dental center at the Newark Boys and Girls Club. We're also a nonprofit 501c3, and we're one of only one, certainly the only one in New Jersey, but one of only a few in the nation where we have a dental clinic within the Boys and Girls Club. We also now have a vision center where children get eye exams and free glasses if they need it. And now we also have behavioral health.
And it's free to members.
All free to members. There's no payment. We just schedule the children and we provide the free dental care that they need.
Now, Dr. McKeon, let's move it out to the rural areas that you know well.
Right. So
and your organization serves?
We're a federally qualified health center. We're a nonprofit as well. We have 9 sites throughout.
And you serve rural areas as well. Describe what's going on there.
Rural areas, Medicaid and uninsured mostly, and we have a lot of pockets of needs throughout. Our service area. And Dr. Ramos is right. About 42% of children who do have Medicaid don't access dental services. So even though they have insurance, they don't access dental care. So part of our challenge is bringing the care to them in those many pockets. So one of the things that we're happy to have, thanks to Partners for Health and Delta Dental support, we're going to have a mobile dental van that will go. A mobile
dental van?
Yeah.
So you go out and do what?
We're going to go out into the community, into different areas in the community and provide dental services. There's 2 dental rooms on the van to do treatment, fillings, extractions. We've been going out for a while, doing preventive services, but we're very excited to have an actual dental van with 2 chairs to be able to go out.
It makes a difference when you actually go to where people are.
It does, because transportation is a big barrier for patients. So cost is a big barrier.
And also, let me think about this, because you deal with some seniors as well.
I deal all ages.
But let me deal with the senior population that all of you know, but I'm going to press this a little bit. With the senior population, them getting to access is always a difficult issue. Transportation is always a difficult issue, particularly in New Jersey. Never easy to get around. But for seniors, getting to seniors, important?
Absolutely.
Talk about it.
Absolutely. Well, one, seniors think when they get Medicare, they get dental services, and they don't. So that's the misconception.
Right.
So it's the same way they had before. They had no dental insurance. Patients need to come to the hospital. They come for their medical care. We offer them dental services there. We provide the full range of services. We offer them a discount if they come, if they're paying cash and have no insurance, which most of the seniors don't. So we offer them a discount. We provide emergency services, and there's a lot of decay and poor hygiene, especially as people get older. They have physical disabilities, so they can't brush, they can't floss. I have 2 hygienists who work with me who see patients every day, providing the cleaning and services and education to the patients. We put them on fluoride rinses. We give them prescriptions for fluoride toothpaste, things like that. So to help in some of the prevention areas.
I'm curious about something. Each one of you in your own way, a nonprofit, and the hospital organization you're connected with is in fact a not-for-profit.
No, it's a for-profit.
A for-profit organization. But what I'm curious about is, and by the way, many hospitals are nonprofits, so that being said, and the foundation community is involved.
Right.
So here's what I'm curious about, from a public policy point of view, healthcare. How is it that oral health and all the issues you raise connected to oral health, all the other diseases, all the other health problems associated with that have long-term serious ramifications for people's health and also from an economic point of view, serious problems. How come this is not some sort of serious public policy issue on the part of the state and the federal government? And have I missed the public debate on this?
Well, it's a huge problem. Currently, we don't have a dental director, a state dental director, mandating policies to improve oral care access.
Is it embedded within the Department of Health?
I think so.
I think so. And you're the experts in the area.
Well, you know, and it is a huge problem. It really is a huge problem.
Should there be someone designated on the state government level heading up oral health?
Absolutely, 100%.
And why do you think there isn't, given this conversation with 4 people who live it every day, who have no particular political or ideological point of view, are only interested in the health of those you serve?
Yeah.
If I can answer, there was a bill just introduced that would create that office, but it was not signed by our governor. So
what's the argument against it?
That I don't know.
Is it the economics?
I think it is funding.
Absolutely.
It's funding.
It's funding.
It's not a
And
priority.
For the office of it?
Yes, for this
Funding
position.
the office.
Funded
The position of dental director.
Absolutely.
Well, then
But what would a dental, for argument's sake, what would a dental director, what could a dental director do, an office of the dental director in the state of New Jersey? Hypothetically, we'll cover this on our producers who are here, deal with our other series called Capital Report, know that we're going to follow up on that end as well and try to understand this. What could a statewide office of dental director do with respect to the issues we're talking about right now? What could he or she do? Realistically.
Policies, implement policies. For instance, I know I've worked with several FQHCs, federally qualified health centers. And for instance, if a mother walks in with a 2-year-old, that dentist, a dentist at an FQHC, can say, look, I'm not ready to see that 2-year-old. Bring that child back when he or she is 7 or 8. And I think that's wrong. It should not be.
And so you're saying government policy should state what?
I think government policy should state that targeted populations, low-income, underserved communities and families, they should be seen at all FQHCs at a certain age.
But what about seniors? You're not, I don't want to get into it too much, but why should seniors be different?
Well,
and those who are homeless and veterans and others, I mean.
Let me tell you, the teenagers I see, where we're extracting
We haven't even
teeth.
talked about that. But
Young
that's
adults extracting teeth because they are decayed beyond repair.
Okay, so an 18-year-old comes in. He or she has what have you seen? What kind of oral health issues?
Severe decay. Severe decay. I mean, and what do teenagers do? They drink soda. They drink sports drinks. It's all acid and sugar on the teeth.
And he or she's
it
about to
destroys
go
them.
off to college.
Right.
And what happens?
Right. Then they have
Could
a
it
toothache.
impact his or her
Absolutely.
ability to be successful?
Absolutely.
And higher education?
It starts at the beginning with young children, and it continues through teenage years.
if you look at the prison rates, you know, when you're in
prison
prison.
rates? What does that have to, now you're really complicating
Well, when
things.
the majority of the people that are incarcerated, most of their teeth have been extracted. I mean, it's a systemic problem. It starts infancy and it just progresses. It's a cycle that it's just unbelievable.
If I can add one thing,
I'll bring it
Steve, and
back
I don't
in,
want to
Doctor.
leave this topic go with the dental director. I think we
I'll come back to capital report, I promise, but go ahead.
Okay. I think what's important is
Last
that
comment.
someone needs to put all the parts together. Okay, they need to see what are the decay rates in New Jersey? What are our citizens suffering from? What is the dental community doing about it? What is the New Jersey Dental Association doing? What are the dentist members? What are the nonprofits doing? We need someone to take the helm to be able to provide the services that our
Because it's not like there
citizens
aren't
need.
organizations out there
They're out
doing
there,
it.
but there's
all
no
doing it.
coordination.
Okay, final comment on this?
I was just going to say that we actually encourage our children to come in by age 1. So our FQHC, we see children by age 1, and we have pediatric dentists with us that work with us.
Okay.
And
Absolutely.
with regards to the policy, I mean, there's a lot that can be done that would significantly improve New Jerseyans' oral health. One is a water fluoridation. That's something that can be done relatively inexpensively and would have a significant impact on patients.
Is there a debate on this?
There is.
There is a debate,
Big debate.
unfortunately. Yeah.
What's the debate?
You have a very strong anti-fluoridation community.
It sure is.
And so that whenever, unfortunately, the way that our laws in the state are is that if you're going to add fluoride, it needs to be done water company by water company, town by town.
Okay, we'll do that on capital report.
Yes.
Is the Pandora's box opened
Yes.
again
It is.
here on Caucus? I
There you
feel
go.
it.
Well,
Hold on, let's do this, because while Caucus tries not to do public policy, it's impossible not to
Right,
have
not
it creep into it because it's relevant. But let me ask you this in the time we have left. Can we give some tangible, practical advice to parents watching right now? Because I know we talked about seniors, we talked about teens, we talked about a whole range of populations. But for parents watching right now, can we give some practical? I mean, I know as a parent of 4 kids, but 3 of them who are 13 and under, my wife and I are talking all the time and asking, did you brush your teeth? Did you brush your teeth? Flossing, forget it. I mean, that's a whole nother story.
yeah.
What are some practical things that we need to do to help our children have the best oral health?
First, I would say the oral health, your oral cavity is the gateway to total health. Everything starts there. I instruct or tell my patients and my parents to sit with your child, have them watch you. Kids learn what they live. Have them watch you brush and floss and be meticulous about it. They're going to follow in your steps and your acts. So just take out the time to do that and really just make sure that they visit the dentist on a regular basis. I mean,
Don't skip those appointments.
As
Right.
basic as it sounds, that can prevent so much.
Someone else, yes.
So, I mean, I would definitely encourage them to brush and floss, but there's other things they could do if they don't want to brush and floss. Use a fluoride rinse, especially for children 8 and above, that, you know, they could do that.
Fluoride rinse.
Right,
8 and above.
over-the-counter fluoride rinse. There's, you know, I think even there's some that you could use at age 6 for like slightly lower concentrations. Having a water bottle, carrying a water bottle
How does
around.
that help?
Because basically the bacteria in the mouth, whenever you consume a substrate that the bacteria could act on, mainly sugar, it produces acid, and the acid is basically what causes dental decay.
And we need to cut back severely on the amount of soda we are allowing our children to drink, correct?
Absolutely. I think the nuggets here are children need to brush 2 times a day for 2 minutes each time. Twice a day. They need to be supervised. We did a study where we asked parents, do your children brush? They say they did brush twice a day. Then we asked them, did you watch them brush? And the answer is no.
I don't watch.
Right. You got to watch.
So
you got to
we can't
supervise.
it's not that we don't trust them, it's that they don't know what they don't know.
Right.
How do they know what 2 minutes is?
Right. Timers.
Timers.
There's so much on the market they can use.
wow.
There's iPhones. We have 2-minute videos that they can brush to. They can sing a song with the radio.
I
There's
like
so
this.
many things. So that 2 minutes twice a day, supervise them. That's important. Parents need to be on top of this. And then, of course, the age 1 visit. We've got to get in touch with
Age 1
dentistry.
visit. What do you got?
It should be water and milk for children. There should not be juice or soda or any of that. And there's no reason for children to be drinking juice. They can,
There is no reason for children to be drinking juice.
No. The Academy of Pediatrics says that children should have, if anything, 1 small juice box a day. Children get in their lunch boxes. They have it with dinner. They have it with snacks. They're bathing their teeth. I would say water and milk. If we could stop that and stop the soda and sports drinks, we would go.
Sports drinks?
Absolutely.
How did that get into this in the last minute of the show?
It's sugar in acid.
How you get your energy.
Yeah.
It's sugar.
This is not, sports drinks not good?
I always tell my parents, dilute. If you absolutely have to give them juice, you've got to dilute it. You've got to put water in there.
Sugar.
Absolutely.
Yeah. Water bottles.
Absolutely.
Water bottles.
Water bottles.
Water is
bottles.
the key.
water bottles.
So whatever it is, dilute it.
Dilute it.
That's the safest move.
Because you're dealing with families that are low income, and you know, they go out and they could buy a big thing of apple juice for $1.99. Just dilute.
Well, all of you have done a great public
Yes.
service, and you've also made it clear to us and reminded us that oral health may just sound like oral health, but it is, as I say, the mouth is, you know, the avenue to the rest of our body and the rest of our health. You've done an important public service. Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Delta Dental of New Jersey, Partners for Health Foundation, ADP, the Fidelco Group, Suez, Johnson & Johnson, and by Cone Resnick. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com, and by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
Hi, I'm Dennis Wilson, President and CEO of Delta Dental of New Jersey. You probably know that visiting your dentist and daily at-home care are necessary for maintaining good oral health. What you might not know is that your oral health is connected to your overall health. Oral health may impact conditions like diabetes, blood disorders, and heart disease. Regular cleanings and checkups allow your dentist to assess your risk and keep you and your smile healthy.